Good afternoon, everybody. I hope you can hear me. Welcome to today's webinar. My name's Yola Jacobson, and I'm the Transform Manager, which is the NatSpec CPD service. Today's webinar is going to be given by Lisa.Hart, who is Deputy Director at Henshaws College. But before I hand over to Lisa to talk about disaster recovery and business continuity, so without further ado, I am going to hand over to Lisa now and stop sharing my slides.
So we're going to look at disaster recovery and business continuity. So this is a subject that NatSpec approached me to talk about because of my previous experience before I came to Henshaws. So who am I? So I am Lisa.Hart, Deputy Director at Henshaws. I've been at Henshaws for about 6 years, and before that I've worked in mainstream education. But before I decided to join education, I worked for a major mortgage company as their risk manager. And one of the things that we had to do was bring in a new business continuity plan. And I was involved with bringing that in, writing it, designing it, and training staff. So I worked for exceptional people that were very experienced in disaster recovery and business continuity. So I was very lucky to learn from the best. So the aims of today's session is how to create a realistic plan that your organisation has confidence in. Making teams proactive rather than reactive. Now, in the last 2 years, we have had to be proactive, but we can almost sigh a sigh of relief and start thinking about how we can be proactive rather than reactive. Look at some pre-planning checklists and testing scenarios that we could go through, and also the importance of well-being in the face of a disaster, because if the people running the disaster and looking after the disaster are not okay, then we can't respond to the disaster well. So we're going to talk about what is the difference between an emergency response, a disaster recovery, and business continuity. So these are phrases that I use a lot, and they are very different from each other. We're going to talk about how we were not prepared for this, and by this I mean a global pandemic. What did we learn from it, and what do we do now? So the difference between an emergency response, disaster recovery, and business continuity are timeframes. So an emergency response is act now. So that would be, you have a fire and you have to evacuate. Disaster recovery is what is going to happen in the next 24 hours to protect everybody. So if you've had a fire and you've had your emergency response, your disaster recovery is what's going to happen in the next 24 hours to either bring everybody back or to work out what we're going to do going forward. Business continuity is how do we plan to carry on our business over a longer period of time. And I know it sounds simple, but it's the continuation of the business. So if you have a fire, emergency response is evacuate. Disaster recovery is how are we going to get everybody back. Business continuity is if the fire has taken hold and we've lost our building, for example, how do we relocate? How do we carry on as a specialist college or a school, still providing that service? So how were we not prepared? And the simple answer was nobody was. So these are just some things that happened. If you can cast your mind back, and that's not always a good thing to do in the last 2 years that we've had, but look at what happened with COVID. So it was the 31st of December 2019 that China contacted WHO to advise them of the pneumonia type virus. So those dates since then are the way that it started to grow and the way that we started to take notice of it. So from the 31st of December to the 21st of January, this was always a flu type pandemic that wasn't in our remit, and it wasn't really important to us. Then Professor Whitty, who we'd never heard of before, confirms the risk to the UK is low, because at that point, that's the evidence that we had. We then had a Chinese couple from Wuhan become ill in Italy. And then we realised that it was coming to Europe, and we changed our risk to moderate. And then on the 31st of January, COVID came to the UK. So that is 1 month exactly from learning about COVID to it coming to the UK. Sage then told us we did not need to restrict any mass gatherings. We started doing the testing. Italy started having surges in their cases. Sage then came and said a couple of weeks later that we need to do social distancing and we need to close the schools. We then had our first death of a British person to die from COVID. 3rd of March, Boris did his famous handshaking with everyone and said, it's fine, I shook everybody's hand. Sage then told us that afternoon that we shouldn't be shaking hands with people. 4th of March, we had cases rise to above 100. And then on the 11th of March, who declares a global pandemic? And then 5th of April, Boris goes into hospital. So from the first case and the first knowledge of COVID, the separation was 59 days. So the first COBRA meeting and the national lockdown, there were 59 days. So there was absolutely no way that we could ever prepare for the scale of the emergency that we were going to face. We were initially told on the 17th of March by Dr. Valence that if we could keep these cases below 20,000, that would be a good result. As at the 2nd of March, which is when I wrote these slides, we have lost over 162,000 people, 19.3 million confirmed cases, with nearly 439 million confirmed cases worldwide. So we were trying to keep that below 20,000. So nobody was ready. So how are you ever going to be proactive if you don't know the scale of what is coming? So given the speed of the pandemic and the mixed messages, and we got a lot of mixed messages, and the unknown science, because we hadn't faced this before, we could do nothing but react. And no business continuity plan was ever going to cover exactly what we had to do when we went into lockdown. So business continuity plans would have an infectious disease scenario, but not to the scale of what we saw. So at Henshaws, what did we do? This is not a full list, but these are things that are relevant to this webinar. So we looked at the BCP and we checked it to make sure that it was all up to date and all the telephone numbers were right. The business impact analysis was updated, and I'm going to come on to that in more detail. We set up the battle room. So this is where all the data is on the walls. We know who's in, we know who's out, and we are ready to manage any scenario. It also means that all the information is held in one place and that you know exactly where to go to look for the folders, to look for the plans, and to look for the most up-to-date data. We risk assessed every house. So we are a residential house, a residential college. We risk assess the bubbles. We risk assess the staff members and the residents. So by doing this, we knew where the highest risks were in our college. All students were zoned in red, amber and green groups. So that meant that we knew If we had to close down, for example, or we could not offer as many places because of staffing levels, we knew the red students had to still come in. We knew that the amber students could stay at home for a period of time, and we knew that green students were okay to do remote learning and could stay at home. So some of the reasons for red students could be they don't have a home to go to, they live here full time. It could be that families were not able to support them. It could be medication issues, it could be clinical needs, it could be safeguarding needs. There were a variety of reasons why students were red. We looked at our policies and we made sure that they were implemented, and we updated things like the safeguarding policy. So we did the addendum that we were recommended to do as safeguarding during remote learning. We put wellbeing checks on staff. So each member of the senior leadership team were responsible for weekly calling certain members of staff just to check that they were okay. And these could have been people who were clinically vulnerable. These were people who we knew were working at home but lived alone, just to make sure that they spoke to somebody and that we knew that everyone was okay. Because at this time, I need to make it clear that we did not close. So we stayed open throughout the whole pandemic, as many of you did too. So this is why we had to make sure that the people on site were okay, but also the people not on site were okay, because there was a real mental health impact for the people that were told, you need to stay at home now. A communication plan was agreed, so staff didn't feel bombarded, but still felt up to date. We felt that at the beginning, lots of people from senior management were sending emails out, and it could get really overwhelming with all the information. So we decided that all communication would either come from myself or our director of HR. Residents and day students who were at home were contacted by allocated staff. So just like the wellbeing checks on staff, we did the wellbeing checks on students so that they knew that we hadn't just closed the door to them and they'd lost their favourite place to come. And then we started the fight to get PPE and more PPE and some more. At first, we really struggled, as everyone else did. And we had a local school that were making visors for us. We were trying to get face masks. We were looking at aprons. We couldn't get aprons, and gloves were really hard to come by as well. So this was what we had to do in the first few weeks. What we did find was one of the most interesting parts of the pandemic was the hierarchy of our staff. So this is your standard hierarchy for any college, school, etc. And you have the SLT at the top, the decision makers and the people that run the college. You then have your middle managers, your therapists, your teachers and your care staff. And lower down on the hierarchy, we had the support areas such as housekeeping, maintenance, site team, etc. What actually happened during the pandemic was that our most critical areas became the top tier. So without our housekeeping team and our maintenance team and our site teams, we could not have stayed open. So the housekeeping team was essential for making sure that we were safe and making sure that everyone was okay from a COVID and infection prevention control point of view. The maintenance team were essential, as were the site teams. And then as you go back down the hierarchy, we were finding that the SLT, yes, were running the COVID response, but we needed to make sure that we could stand back and allow everybody else to do their roles in order to keep everybody safe. So the hierarchy changed completely during the pandemic. So how do you develop a realistic plan? So a business impact analysis, and in other words, what we need and by when. The business impact analysis will be easier now because we've lived through it and we know what we needed to keep. So if you Google business impact analysis, you will come up with a lot of complicated plans, a lot of complicated spreadsheets. But the business impact analysis is, what do you need and by when? So our immediate plan was, we have to have IT and communications. That's because we were working on site, but we also had remote learning. We were communicating via Teams and Zooms with staff, so our staff meetings were done via virtual. We were making sure and doing check-ins with people. So our IT was essential. And if you speak to any organisation, whether it's education or finance or NHS or anything, IT and communications is always the key. We then had to make sure that we had the site staff to keep running. So we knew what students were coming in, but on a day-to-day basis, we couldn't guarantee the staff that were coming in because they may have become ill or infected. So we set up in the battle room an ongoing percentage of what staff we had, and we had that first thing in the morning. So we knew everyone that had come through the door, we had registered, so we knew that we could keep our staffing above a certain amount. We have kept that going, and it is now a virtual data analysis, but it still ensures that we know that we are fully staffed for as much as we need to be. The care staff were essential to support the people on site. So they've got the training for those individuals. They know their medication needs. They know their personal care needs. They know everything about those individuals. So they were essential to make sure that we were keeping the people safe while we were on site. So as long as we had IT and communications, we had the staff site running the site, and we had the care team supporting the students, then everything else was worked out. So your business impact analysis. So consider a scenario where you need to vacate your students between 0 to 2 hours. And what would you need? So this is an emergency response. So you get a phone call and you're told there is a gas leak and you need to evacuate. If you had to evacuate immediately, do you have access to all your contact details and your parents and your emergency contacts? Do you know the medication that every student will need between now and in 2 hours' time? Do you know the personal care requirements? So the question, where would you go? Where you're going, can they meet your personal care requirements? How are you going to refresh people? Do you have food there? And how are you going to get staff there? So these are the things that you need to think about during your business impact analysis. So now you do it. So that's your emergency response. Now you do it for 24 hours plus. So this then becomes your continuity plan. Can you keep everybody safe and still provide a high quality service if you cannot access everything you need? And the answer is, you've already been doing this for the last 2 years. But if you have to move off-site, and if you think of the scenario at the beginning with the fire, would you be able to set your college or school up off-site if you needed to within 24 hours? One bit of advice I would tell you is keep the business impact analysis simple. What do you need, by when, and how will you do it? And that, as I said, you can Google business impact analysis, but they are overly complicated. So you just need a 3-column spreadsheet to begin with and work out what you need and by when. As part of your plans, you also need checklists. So these are essential during emergencies. The reason that they're essential, and scenarios that I've done in the past and emergencies that I've managed, the checklists have become one of the most essential things. And that's because you may not be available. So if you've planned everything and you've written the business impact analysis, you might not be there, or you might be the emergency. The emergency may be so upsetting that you need a list to follow. So if you think about what we have been through, and there has been trauma over the last 2 years, if you think of a scenario where it is very, very upsetting, it's very easy to follow a list. So you don't have to think about the emotion of what you are doing, and you have a list to follow. And you need to keep checking that you are on track and you're following the plan. So an example of a checklist could be, you make sure that everybody has arrived that you need, and everybody has registered as attendees, especially if you're doing something online, because you could have lots of people on your Teams or Zoom call. You brief all present on the known situation. So don't assume everybody that's turned up knows exactly what is happening. Confirm the roles and responsibilities of those at present. And your role and responsibility may be different than your role and responsibility within the college or the school. Appoint an assigned emergency services liaison officer. So if you have got a fire or a gas leak, you need the emergency services will ask you for a number of somebody that they can call, and that becomes your liaison between the emergency services. And that's little things like, the emergency is now closed, you can return, or this is going to go on longer and there's structural damage and you cannot get back into the building. Do you need to contact the local emergency planning unit? So your local authorities will all have this planning unit, and they can help and they can support you. Has any of staff or students been injured? Do you need to invoke any counsellors? So if there has been a death on site, do you need any external support? What parts of the building are affected? So it might be that you can use 50% of your building, but you can't use the other 50%, but that's where all the toilets are, that's where your kitchen is, and that's where your dining room is, for example. So what day zero requirements are there? What do you need right now? And can any of the unaffected sites assist with the invocation? So we've got a site 2 miles down the road within the Henshaws charity. Now, it might be that for some students, we can ask to go and work at their site, and that would work. So if you have something similar, think about how you're going to get there. Have all your visitors been accounted for? So has everybody that is on site been accounted for, and you know where everybody is? Is your IT affected in any way? And does the IT plan need to be invoked? So I've had a situation before, and not at Henshaws, but in the mortgage industry, where you have your 24-hour backups, and when we put the backups in, they were blank. So we never tested it because we got a report that said that the backup had taken place and everything was okay. Because we never tested it, we didn't know that we had no backup. So we lost the IT system. So again, that wasn't Henshaws, that was at the mortgage company, but it had a major impact on the invocation of the plan. Do telecoms plan need invoking? So do you have a telecommunications plan? So if all parents are phoning up reception, how do you get all the information to them? And if they keep ringing and it's going to be engaged, they're going to be upset, they're going to be angry by the time they get there. Do you need to advertise mobile phones of the company or the organisation to say, if you are worried about this particular group of people, please ring this number? Because if you can't get through, you always assume the worst. So contact the governors or equivalent. Who's your liaison between the governors, just to tell them what's happening. And you either need their help or you don't need their help. Has something happened that you need to contact a family member for? And does a press statement need to be prepared? And that's when the planning unit comes into force to help you with your media response to your situation. The most important things is time. Somebody needs to be allocated as timekeeper because time goes very fast in an emergency. And if you've said, put on your website, we will do an update in 2 hours' time, you need to make sure that somebody says, it's 2 hours, you need to put a website update on. Notes, keep a record of everything. During our response, we kept a decision log, and that decision log is to remind us why we made the decisions at that time. Because in a month, in 2 months, you would forget why you made that decision. Now, it isn't to say that that decision is right or wrong, but it's the reason why you made the decision in the first place. And team well-being. You're doing a lot of checks on the team outside the room, but you need to make sure that the team inside the room are still okay. And who's managing the managers? And basic human needs. During emergencies, people do forget to drink and eat and go to the toilet. So you have to put these into place to say, has everybody had a drink? Has everybody eaten today? Do we need a comfort break? You need to make sure that this is on your checklist on a regular basis. And reflection and learning, take every opportunity to plan for the next time it happens. Now, I really, really hope we never have to have a situation like this ever again, but next time it comes around, we will be ready. So what happened in our sector and what made it harder for us? We were forgotten. So specialist education was forgotten. Boris Johnson did say that schools were going to close unless you had people with EHCP or were considered vulnerable. So within NatSpec, that's all of us. So our provisions were not considered as essential. So we were not given the PPE, we were not given the sanitized liquids, we were not given all the things that we needed in order to run a safe service. And by the time we were recognised, it was too late. And that's really for residential colleges, because if you think about what happened in the care homes, they were not recognised and it was too late. And too many deaths happened because they weren't recognised as essential. Many of the teams were involved with the new hierarchy structure and didn't have the experience to be ready for it. So if you remember, we had the SLT at the top and the housekeeping at the bottom. We then turned it round so that housekeeping became the most essential. And that is a lot of pressure to put onto a group of people who have never been trained to do that. And the manager of your housekeeping team or your cleaning team is under increasingly pressure to make sure that everything is done. So you need to make sure that those people that then become essential are supported to do that role. Everyone was scared and every person has been affected. So either from loved ones, residents, families, or friends. So everyone was scared. So it's really hard to work together as a team when everyone is scared. At Henshaws, we did it amazingly. And it was a privilege and an honour to work with the senior leadership team at Henshaws because we were scared, but we supported each other. At other times, it might be in emergencies that scare and emotion impacts on the response that you can give. So you have to acknowledge that everybody is scared. And it did not stop. We thought in March, well, we'll do this till Easter, or we'll do it to summer, and then we'll think we'll do it till Christmas. And we are 2.5 years on, and we are still looking at the cases and still thinking about our response to the business continuity plan. So what do we do now? So we look at the future. Most of us are starting to get back to a business as usual type provision. So we are still getting positive cases, but they are very, very small. We did have a spike after Christmas, and that was because of the interaction the staff and students with their families over Christmas. And we did go back to basics for a couple of days, and we did bring some restrictions back into place. And that's why the decision log was so important, because we had to go back and say, what did we do right at the beginning? And do we need to do that again? We learn from our response and we prepare for future lockdowns. Now, it may not be a lockdown for COVID, but if we cannot get to work for any reason, we have a plan. We make plans for making it happen again. I really hope it never does, but we formalise our response. And we actually talk about our well-being and the impact it had on us. And that's particularly poignant for people that were managing the response, because there is an impact on well-being, and you have to make sure that all of you are still okay. And it is a very simple question of, are you okay? And we have to get better at saying, no, I'm not, and I need some time out, or I need some support. We need to put emergency plans in place for the areas that we couldn't fully control. So there were areas, and there will be areas for you, that it didn't go as well as you'd like it to have done. So now is the time to think about that and see how you can do it in the future. We assess, we reflect, and we have a proactive response. So reflection is a huge part of disaster recovery and business continuity, because you make sure the next time it happens, you are prepared. We train more staff to do more tasks. So our senior leadership team are now an amazing team of emergency responders, because they've had to be. Had we had the training to begin with, I don't think it would have made a huge amount of difference because of what we were looking at. But now we have a crack team of people who are amazing at emergency response. But is our middle leaders, are our teachers, are our support team. And we need to buy extra toilet rolls. So learn, reflect, and stock up on new rolls. So the aims were to create a realistic plan that your organisation has confidence in. You will all have a realistic plan now that you have confidence in, because you've had 2.5 years to build it. Now you need to look at other scenarios and to see whether it covers everything on your plans. Make your teams proactive rather than reactive. So start thinking about other scenarios, like the gas leak, or like the fire, or like loss of a key personnel. How are you going to carry on with those things in place? Get a pre-planning checklist and test your scenarios. So a pre-planning checklist in your business continuity plan is essential. And put the importance of well-being up as priority in the face of a disaster, and make sure that it is on your checklist, and make sure that everyone is okay. So thank you for your time. And are there any questions that you'd like to ask?
Thank you very much, Lisa. That was a really comprehensive presentation, and it's like seeing your life flash past you, isn't it? 2.5 years, and what everyone's been through is quite astonishing. We've learned a lot in good ways and bad ways.
Yes.
So thank you so much for that. If anybody has any questions for Lisa, could you type your questions in the question and answer panel on your screen? It'll either be in wherever your controls are, at the top of your screen, or at the bottom of the screen. Lisa, can I just start things off while people have a think? In terms of what you learned from it, and I know you came from an experienced background and you had put these things in place before, is there any sort of one key thing that was a real surprise for you in terms of how it panned out at Henshaws and how it was managed?
Yeah, absolutely. So my experience had been from a mortgage company. So it was quite unemotional. We talked about money. How are we going to make sure that everyone is back up and running to make sure we make money? Because that was our business. How do we make sure that everyone can pay their mortgage and give us the money that we want? With Henshaws, it is about the people, and it's making sure that business continuity make sure that everybody is safe. So I'm not saying that the finance companies aren't about the people, but the highest priority is making sure that money starts rolling in. Whereas with NatSpec colleges, it's all about the people and making sure that we can still support them and support their needs, but in a way that is supportive for them. So it can be very upsetting to move to a new location if we haven't had time to do social stories, if we haven't had time to do transition checks and make sure that they're happy to go into that building. And it can be very, very upsetting for them. So it's, if you have got a place down the road that you think you might have to go to in a disaster, maybe take some of your students who will struggle with any transition to the new location, just to, so that they can see it in a peacetime rather than a business continuity plan. So yes, the NatSpec colleges and schools is all about the people.
Thank you. I don't know if anyone who's listening has got anything to share about how it panned out at their organisation. Certainly the thing that you talked about not being recognised as a priority was a major issue at the start, wasn't it? So we just had to get on with planning anyway, without the right equipment, without the right protection. And people, as far as I recall, were incredibly creative and resilient over that time, but it does take its toll. And I agree, your focus on staff well-being and just checking if people are okay, just even, day to day, have you had a break, have you had something to eat? I think absolutely crucial. I'm just checking the panel to see if there are any other comments.
Just taking that point, I would say the hardest day that we had, certainly at Henshaws, was the 16th of March. And I remember it because that was the day that we thought Boris was going to close all the schools. And I can remember you could hear his speech echoing down the corridors because everyone was in their offices watching the speech and saying, we're going to close all the schools. And that's when we realised that all the mainstream schools were going to be closed, but not necessarily us. And I think it was really hard for us because you just keep going until that moment that you can breathe, because we're going to close and you can start getting your thoughts together. And I think for me personally, that was the one day that I realised it was too hard and I don't think we can do this, because you were trying to get to that point, and after that point everything would be okay. And that lasted for about 2 minutes and I dusted myself off, and then you think, okay, what are we going to do now? But I think that was the hard bit for me personally, was everybody else gets to breathe and redecorate and do their gardens and post on Facebook their new exercise regime. But actually we're just going to carry on as we are. And we felt at the time we were the ones that were hard done by, because we had to carry on. Some conversations that we've had with each other is actually we might have been the lucky ones, because we still had a routine, we still had people to talk to, we could still spend time with our colleagues, and there was a level of normality on our day-to-day. And actually the mental health impact has been the people that had to go home and stay at home. So reflection and hindsight, maybe we were the lucky ones, but we didn't know it at the time.
Well, that's very interesting, your comment about people, the impact on people that went home. Yeah. Very interesting, because I know when we did the home learning project right at the beginning of lockdown, there was a lot of concern about people's well-being who had to leave college. Yeah, it's extraordinary to think that the amount of learning that's gone on over this period, and I think your presentation really showed that beautifully. Personally, I think in terms of managing learning in different scenarios, it was absolutely crucial. And your point about making sure your IT systems don't fail, and if they do fail, what happens?
Yeah.
Did you actually have that scenario planned into your plan, or is it just not an option?
we spent a lot of time with our IT department, and there was a lot of pressure put onto them, because it was, you have to make sure this works. You have to make sure we've got a contingency server. You have to make sure that it's up and running. Are there any things that we can put on cloud? So we've been talking a while about Microsoft 365. We suddenly brought that in a lot quicker than we would have done had the pandemic not happened. Really simple things like, do we have the TV screens to be able to do remote learning? Do we have the laptops for staff? Do we have the knowledge of how to use Zoom and Teams? So we learned how to use Teams almost overnight, and we'd never used it before. But that was critical for our response and our business continuity plan. So we've now got things in our business continuity plan that, for the 15 years experience that I had in risk management, I'd never thought of, because we were in a much different place. So we did have the contingencies in place, but thankfully we didn't have to use them.
Thank you. I had Mark asking whether we would make the slides available for this presentation. Is that okay to send out to people, Lisa? That's great. And also, Mark, just to remind you that this webinar is being recorded. So, and it will be available on the NatSpec YouTube channel in about 7 to 10 days, and you can access it there as well.
And if anyone wants to ask me any direct questions, or if they want to see anything that we produced, or see if I look at their documents, I'd be happy to do that as well.
Thank you for that offer. Are there any other questions for Lisa before we close the session? Because I know lunchtime's a busy time for people. I know you've probably all got sessions, teaching, meetings to go to, but now's the chance for you to ask any other questions to Lisa. Any other questions before we finish?
So Mark has said, because a simple template is available. Yes, I've got templates that I can include as well.
Thank you. That's great. Thanks, Mark. So it sounds like people found your presentation very practical, and something that they would like to learn from. And also, if you've got those templates, I'm sure they'll be very handy. Okay, so I'm going to bring the webinar to a close now, and I just want to thank you again, Lisa, for such a comprehensive and thorough presentation. People are sending messages to you saying thank you. And if people want information from Lisa, do you want to type your email into chat? And then people can contact you directly. Thank you very much. I'll let people just copy that before we close. And just to
actually, I can add it to the slides.
Oh, thank you. Thank you.
And then that's in there as well.
And just to reiterate that I am always very happy to hear from people if they've got something they think they'd like to present as part of the webinar series. It really is a peer-to-peer support opportunity. It's a networking opportunity. It's a chance to consult with colleagues. It's a chance to tell people about practice that you're developing, or you just want to let people know about because you think is being particularly effective. So for those issues, I'll just put my email in here again. Contact me, please, about that, about any ideas you have, or perhaps talk to any colleagues that you think might be interested, because we're always looking for ideas and topics. And I have to say, Claire would be very cross if I didn't also mention that you are able to book for our NatSpec conference in June. Information is on the website. We are meeting face to face, hooray, for the first time since 2019. So book your place now for the conference in June. Okay, I'm going to finish there now. Take care, everybody. I don't think there's any questions that we've missed there, Lisa, are there?
No, there aren't.
No, there aren't. And thanks again, Lisa, for everything.
Thank you.
Bye.
Bye, everyone.